as a craniofacial and pediatric plastic surgeon, sometimes we have to rely on technology in order to get an excellent result. So this child is 9 years old, and this is a 3D printed model of his CAT scan. He was born with right coronal craniosynostosis, which means the right coronal suture fused prematurely and resulted in the right part of his face being pulled back and not growing properly. So he underwent several surgical procedures at another hospital by other craniofacial surgeons, and he ended up with multiple holes in his skull. And this is not normal. So after a genetic analysis, we determined that he has a genetic bone disorder where the bone just doesn't regrow properly. So initially we were considering taking bone from the back of his skull and using that to reconstruct the holes in the front of his skull. But if we were to do that, because of this genetic abnormality, it wouldn't work. So although I generally like to reconstruct bone with bone, in this case, we're going to have to use modern technology and what's called a PEEK implant, so a synthetic implant. So 3D printed model of the patient's CAT scan. We did a virtual surgical planning meeting with the company that makes these plates, and using computer models and imaging, we told the company where we want to make the cuts, what bone we want to remove, and how we want to reconstruct it. So the company just provided me with a model of the existing skull, in addition to bone cutting guides, which we will use in the operating room in order to mark and then properly cut out the abnormal skull. So we're going to remove all of this skull right here. Then we're going to be left with a very large skull defect, and we're going to reconstruct it using several PEEK implants. So the pieces will fit together, reconstructing the skull. So this is an example of technology being used, first of all, to come up with a surgical plan, and then also in order to create anatomically perfect synthetic implants to be used in the reconstruction of this 9-year-old skull.